Hello everyone, today's topic is preeclampsia. So let's get into it. Preeclampsia is characterized by pregnancy induced hypertension after 20 weeks of gestation along with proteinuria. Preeclampsia can lead to various complications including prematurity, IUGR, eclampsia, hemorrhage, cardiac failure, and multi organ failure. Risk factors include maternal age over 40, nulliparity or a new partner, multiple pregnancies, long pregnancy intervals like more than 10 years, high BMI more than 30, diabetes mellitus, family history, and pre-existing vascular disease like hypertension or renal disease. Severe eclampsia is characterized by hypertension of more than 170 by 110, significant proteinuria, headache, visual disturbances, hyperreflexia, and other symptoms. HELLP syndrome is characterized by hemolysis, elevated liver enzymes, low platelet count is associated with preeclampsia and eclampsia. Management involves delivery of the baby as the definitive treatment. Patients with chronic hypertension are often prescribed aspirin to reduce the risk of preeclampsia. Blood pressure is treated with labetalol, which is like the first line. Other medicines like nifedipine, hydralazine can be considered. Magnesium sulfate is used pre-delivery to reduce the risk of seizures and may help lower the blood pressure. Answer this scenario in comment section. A pregnant female 35 weeks with BP 180 by 130, severe headache, blurring of vision, bilateral lower leg edema, bilateral papilloedema. What is the next step in management? Please answer this scenario in comment section.